Hi, Dr. Dorado. You're on mute still. Oh, there we go.
Hi. Hi, how are you?
Oh, are we on with the public? We're public? Oh. Hello, Dr. Dorado.
Hello, Mayor
Can you
Breed.
hear
Thank
me?
you so. Yes, I can.
I can't hear. Oh, wait. There we go. Hello?
Can you hear me now?
Yes, I can hear
Oh,
you.
wonderful.
All
Hello.
right, I'll just do a few introductory remarks. Hello, everyone. I'm San Francisco Mayor London Breed, and I want to thank you all so much for joining us here today. We know that during the coronavirus pandemic that has impacted not only us here in San Francisco, but the entire world. It's really been challenging, I know, for us physically to be away from our friends, our family members, our loved ones, but it's also been very emotionally and mentally challenging. And we know that it's important to, yes, take care of ourselves so that we are able to get through this, but we also, that includes our minds, that include making sure that we're able to cope um, with the difficulties of being isolated in some cases and staying at home and the struggles that we know exist as a result of, I guess, isolation. And I'm joined here today by Dr. Joyce Dorado, who works as a trauma-informed doctor at UCSF. She works with children in particular, but also is very familiar with the impacts on trauma in people's daily lives. And so I wanted us to have an opportunity to have a conversation. I also want to take this opportunity to mention Heal San Francisco, a program that we have available to San Franciscans where we have volunteer clinicians who are available to talk with you. If you want to reach out, please call 311. Any information that you might need in terms of help or support, because we know that we can all use some help and support at this time. I just want to also mention one of the things that I think I appreciated the most during this time is receiving a note from a neighbor who said they were the block captain. And if there were anything that I needed, whether it was food or the pharmacy run or errands or just someone to talk to, they provided their name and their phone number. And I just thought, what a nice thing to do. And it really it made me feel really good about my neighbors and what was happening and the challenges of being socially isolated from people in general. And it can have a tremendous impact on us. And so I wanted to take this opportunity to talk with Dr. Dorado about, just tips or suggestions or advice on how to cope. Because we know, as we said, we're all in this together, but the fact is, we're all in this together except we're separated. And we're separated from one another. And it's challenging when you see people who are at senior citizen homes visiting their relatives and they have to stay outside and they can't interact with their relatives and their friends. It can be quite challenging. It's probably challenging for many people who are parents and you have kids who can't go and play with their friends. They can't just go outside and play at a playground. And there's a lot of challenges there. And so it is a tough time for all of us. And we want to do everything we can in the city to reach out to people, to provide resources, but more importantly, to do what we can to protect one another's mental health as we battle this very challenging pandemic together. And so with that, I want to turn it over to Dr. Dorado. Welcome. Thank you so much for being here with us today. So let's the conversation begin.
Great. Well, Mayor Breed, I just do want to take a moment to thank you so much for your leadership and to thank everyone out there who is risking infection from the virus to provide health care and to stock our grocery stores and to make and serve food and to take care of others. We owe a debt of gratitude to you, Mayor Breed, and to all of the citizens of San Francisco and our community who are pitching in to help. And I do want to say too that I'm so impressed with your leadership on not only talking about the pandemic, the COVID pandemic, but really how we all need to come together to cope with the stress and to prevent a second epidemic of, what can happen if we don't address the stress and trauma. So thank you so much for bringing us in here.
Of course. So I want to get started, and I know, I have a lot of questions. I mean, for me personally, right? I am leading. I haven't had a hug since this thing started. And,
oh my gosh.
Usually I'm not, I hug my friends, I hug my family members, but because of the orders, I mean, there's not a lot of affection in some cases. People are used to getting hugs and getting love and getting that kind of emotional support. So in the absence of just what we're used to physically, what are some things that you would suggest that we do in order to kind of get through this during this time?
Yeah, that's a really important question. So I guess I want to say that it is really normal for us to experience stress. It's really normal to feel grief and fear and frustration, and all of that is really normal. And we do really need to honor those feelings because the struggle is real. We're in this right in the middle of this pandemic, and it really is true that there's a lot that science can tell us about how we can actually cope with the stress and overcome the stress and trauma that we're feeling. So I guess I want to start with saying a little bit about resilience. So we talk a lot about resilience, but what is that? So resilience really is the ability to bounce back from adversity. And how many of us see it is that resilience is really being able to face down the sometimes brutal reality of what is, but also maintaining a staunch optimism that we can overcome it, that we are overcoming it. And so part of that is really recognizing that we can cope. We've got what it takes to get through this. A little something that helped me when I heard Dr. Eppel over at UCSF talk about this, when we're under a lot of stress, we tend to glom on to all of the really hard stuff, the scary stuff, and the threat, and we tend to underestimate our ability to cope. So one tip, which is a tried and true tip, is to try to decrease the amount of input of the bad news. Like, try to limit your viewing of the news to at most a couple times a day. Really be careful of when you're taking that in. Try not to do it right before you're trying to go to sleep. Try not to do it in front of your small children. And that can sort of help kind of mitigate that constant barrage that can put us into a panic, quite honestly.
Wow.
And then to balance that off, try to pay attention to the things that give us hope. So the fact that it is helping what we're doing to start to flatten the curve, to acknowledge that we have been through very tough times before. I'm here because my parents, who are immigrants from the Philippines, survived World War II in the Philippines. How have your people gotten through hard times? And can we draw on that? Can we know that we do have what it takes to overcome this?
Yeah, and I like the tip about not watching the news at night, but it sometimes gets hard because, you turn on CNN, you turn on MSNBC, and then you turn to channel 2 for all the different channels and the news.
I know.
And the only thing that you hear on television oftentimes is about the coronavirus or what's going on here and what was said earlier today. And it is hard to get away from it. But I do think making a decision to cut it off at a certain time, especially to clear your mind, could be helpful.
Yeah.
And let's talk about a little bit about, just how we can help parents with
Sure.
kids, right?
Sure. Sure.
So parents who have children,
Hmm.
there's of course the learning that some of them are doing at home, and parents are probably helping them with that. But then throughout the day, it's, I'm bored. I want to see my friends. I want to go outside. Can we go to the park? Can we do this? Can we? Like,
Right.
I was one of those kids where I drove my grandmother crazy. Like, I would ask questions. She would say, "Can you just be quiet for 5 minutes?" Right?
Mhm.
Now, at
Yeah.
that time, we could go outside, right? But
Yeah.
now kids are in a
Yeah.
different situation. And
Yeah.
I know this could also be very challenging, not only for children, but it can also be challenging for their parents. And
Absolutely.
so, do you have any advice or any suggestions to help parents cope with being with their kids 24/7 when they would oftentimes get a break with school
Yeah.
and other things and other activities?
Yes. Well, Mayor, that is a great question, and there are some tips of concrete strategies that we can do. I would say, first of all, as caregivers, as people, whether you're taking care of your own children or your parents or whatever have you, it's really important, like they say on the airplane, to put on your own mask before you put on the mask of the people next to you, to attend to your own
Mm,
wellness. So stress can build up over the day for ourselves, for our children. And it's super important to not let it kind of build, 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 because that's terrible for our neurobiology, our brains and our bodies and our health and our relationships. So if we can give ourselves just a few minutes, to take a break regularly throughout the day, the kinds of things we can do to sort of keep our own masks on, keep ourselves from going into a panic, is to take really deep breaths. I'm going to do that right now. If you take a deep breath in through your nose and long, slow exhale through your mouth, right? I feel better already. Take the time to like stretch or like do things that are physical. Um, take the time to try to give yourself short bursts of joy and give your children short bursts of joy. Laughter is really good, and it actively combats the toxic neurochemicals of stress. Gratitude is an incredible way to, there's a lot of science behind if we can figure out things that we're grateful for. I'm grateful that my husband put these beautiful flowers right here in the kitchen that make me feel better. I'm grateful for my beautiful children. I'm grateful that I am breathing right now, right?
yes.
We know that gratitude can do things like lower our blood pressure and make us feel less depressed. And I just want to say, I want to make sure I say this, that panic is contagious,
Mm,
but so is love. So is
yes.
love. Love is the medicine that can help heal us, that can help us stay well in the face of this. So love up your children. Give yourself love. If you don't have people to hug you, give yourself a big hug, because again, like, we're hardwired. It sounds kind of omy foamy to say that, but truly, we're hardwired for love to heal us and for to calm us down when we're super stressed out. That connection is so important.
And that's a good reminder because what I noticed that has been happening in San Francisco and all over the world is people who are coming out and clapping for the healthcare workers, or someone who is a musician playing music for their neighbors, and just making other people feel good, spreading
Yes,
that joy, spreading that
yes,
love,
yes,
spreading that laughter in some instances.
yes, yes.
Definitely brightens up my day. I get messages from friends with these really funny, like, what do you call those things when people send you,
Is it like
what do
a
you call them,
meme? Is it a
Andrea?
meme? What is that?
Yeah, the memes and all that stuff. Yes,
Cartoons? Yeah.
I'm not up to date on the
Same.
terminology, but the memes and just the funny things, it really does brighten your day. And trying to look at things from a positive perspective, trying
Yes.
to stay focused on the fact that how blessed, I feel like I'm so blessed to be alive. I'm so
Yes.
blessed to be around on earth at this time and to serve in this capacity and to help lead the city. But I also realize that there are still a lot of people who
Yes.
aren't in a similar situation, right?
Yes.
We have,
Yes.
there are people who can count their blessings and be happy and joyful about it and weather the storm. But then there are people who aren't in the same position, and they may have lost their job. They may have, they may not have computers for their kids to get the online learning that they need. They may not be able to put food on the table, and they don't know what to do. They may not speak English and understand who they can actually communicate with in order to get the help and the support that they need, and they are probably afraid. And so I guess, do you have any advice or any tools for people who are struggling to make ends meet and struggling with coping and just scared about not necessarily the virus? They're scared about what's going to happen to their livelihood in light of what we know has been a real challenge for so many very low income families.
Yeah, it's a really, you're really pointing out something so true and important, that some of us are carrying more suffering than others. And
Yeah.
what you're speaking to is, the disproportionality around how people with fewer resources are at higher risk for so many things. I want to answer that question, and I want to just quickly speak to a point that you just made before, which is, well, actually, I'll answer it all together. That there are ways that this pandemic are bringing into sort of glaring light inequities that have been
Yes.
existing for a very, very long time. And I hope that what that does is it a call to action for all of us to notice where we have privilege, be grateful for that, and then use our power and privilege to be sure we're helping others, and to lift up the voices of people who are suffering so that we can hear from them, just as you are doing. I know, Mary Breed, you're doing this so well, trying to listen to, like, what do people need?
Yeah.
I feel like being listened to and having people hear us when we're in need, it does actually calm our neurobiologies down, and it helps us. I want to say that altruism, so there's a thing, being kind to others. You mentioned, it's like being kind to others.
Hmm.
Altruism actually lights up the same pleasure centers in our brain as really good food and other sort of pleasurable things, and that actively combats stress. And so I think what I want to say here is that when we're up against a ton of stress, and you named it, some folks are up against so much terrifying stress. One of the things we have to do is to also do everything we can to take those little short bursts of gratitude, of bringing in love, of asking for help when we need it, um, and of knowing that we need to stand shoulder to shoulder to fight the good fight against the inequities that have already existed. I wanted to say that that I know your administration has been reaching out to communities, especially folks who are on the margins. This is exactly what we need. Um, I also want to say that for folks who are up against these things, to do draw on your own cultural strengths and your cultural practices around healing, your own cultural practices. Know that you've got the wisdom inside of you to overcome this. Draw on your own spiritual practices, and for us to sort of continue to lift up and borrow and learn from those practices for each other is part of how we can get through this.
Yes, definitely. And I mean, and I rely on my spirituality.
Yes.
And so it's still very difficult because when you
Yes,
think
of
about
course
it,
it is.
we've been in this for what, a month now, and
Mm-hmm.
people are, of course, growing frustrated, impatient,
Yes, yes,
depression kick in,
yes, yes,
especially with our seniors, because we're asking
yes.
them to stay home for their own protection, but they also need fresh air. They also need to
Of
interact. I mean,
course.
just hearing the stories again about, like, one of my friends, the grandmother stays the in the house with them, but she's downstairs in the basement, and they won't let anyone, go down there. They make sure she eats and everything, but they're
Mm.
afraid
Oh
that,
gosh.
they that something might happen to her. And
Yeah.
so I know that can be stressful, because especially with elderly people who are isolated without a partner or anyone to be around, depression and other things can kick in. The longer this goes on, the longer it can have an impact. And so, tell us, maybe some suggestions on what they can do or what we can do to be more supportive of our senior population.
I love that question. And it actually taps into even how we sort of deal as families with this. Um, First of all, I would say that fear and panic can make us not think clearly and do things that actually can make things worse. So when we're in that panic of, I have an 82-year-old mother, and sometimes I feel in a panic that something is going to happen to her. And so I gotta try to breathe, and I gotta try to know that we are doing everything we can to keep her safe. My children call her regularly, so encourage your children to reach out to your elders if they're separated, whether in the basement or across town or in another state. We can pick up the phone and call grandma, call grandpa,
my grandmother used to love to talk on the phone all day.
Yes, right. And it brings joy to them, it brings connection to them, and then we feel good also because we're helping and we're connected.
Yes.
So I think that's a huge important thing. And also, it's very important to know that there are resources out there. So we know that if we are struggling with our own sort of even pre-existing anxiety and depression, if we have our own history of trauma, if we have our own history of feeling marginalized and isolated, we may be more vulnerable. There are things we can do ourselves and just with our friends and family, but there also are professionals and experts and people who can help. And you can find resources for yourself, for your family, and your loved ones at healsanfrancisco.org. Healsanfrancisco.org is the website for HealSF, the initiative that you've helped to launch. Thank you so much for doing that. Brings together our professionals and our community and our workers to bring best practices and our collective wisdom to try to overcome this. So go to healsanfrancisco.org, and there you will find so many resources. It's okay. We don't need this visual right now. That's all right. What you just saw just now is actually a visual of trauma-informed principles that we're using across the city, in schools, in public health, through Heal San Francisco, to try to help heal our community. So you can check that out. And I've actually referred to a couple of those principles already. So you can check that out there.
And Doctor, the last question I really want to ask, when you talk about communities, because so many of us are so close and tied to our communities, and at this time, it becomes really difficult to connect and to remain, involved in the community that you want to be a part of, because again, you can't connect physically. And I think they probably should have called this, instead of socially distancing requirements, we should have called it physical distancing rather than social, because we shouldn't disconnect socially from each other, only physically. But that doesn't mean that we turn off all communication, because the need for socializing with one another still exists. And now more than ever, with the tools that we have available, the social medias and the internet stuff, I mean, this access is so incredible that there's a possibility, either through the phone or through Zoom or through other vehicles, to reach out and to continue to have these conversations. As much as we would like to be next to each other, there are other opportunities. So tell us what your advice is on staying socially connected to our networks, to our communities, to the people that we want to stay connected to.
Yes, absolutely. So you've named most of it there. It's call loved ones, set up an appointment, a little time. That at 6 o'clock every day you're gonna have dinner with your mom or with your friends through Zoom, or just putting them on speakerphone, being together that way. Social media, absolutely. Even texting.
Yes.
Even texting each other, little texts we can send to each other to say, I love you, I'm thinking about you. I really do feel like with crisis comes opportunity. And we're definitely up against a crisis. There's no saying that there's going to be stress about that. But in the midst of this crisis, honestly, I believe that if we work together, if we act with thoughtful intention and with love, if we reflect on what we're learning as we move through this. I've learned so many things about myself, and what I can, how I can deal with Zoom, but also how I can connect with each other, and what inner strengths I have, what inner strengths you have. If we can learn about that, I really think we can get through this stronger,
Yeah.
wiser, more compassionate, more connected than we ever were before. So definitely reach out and ask for help if you need it. You get to get help. You get to feel better. You deserve the love from the people who love you and from everybody. And if when you go to the grocery store, as a quick tip, thank the checker. Ask them how
Yeah.
they are. Thank you so
Yeah.
much for your work. That makes a difference to them and makes a difference to
Yes.
us. Take every
Y-
opportunity.
Yeah, and I think I've been in touch with people who I haven't heard from in years.
Yes.
A lot of folks are reaching out, and they're just sending messages like "Thank you," and "I hope you're doing okay." A neighbor wrote out in chalk, "Thank you, Mayor Breed, for protecting the
Wonderful.
city," and just all of those notes of gratitude. It just gives me the fuel that I need to continue to do what I can, even in this role, to
Yes.
uplift the city, and I want to make sure that we do everything we can to take care of ourselves and to take care of one another. That's our
Of course.
physical and our mental health. So thank you so much for your advice, your tips. For more information, please visit healsanfrancisco.org or call 311 and we can connect you to support or to services. Don't just sit back and suffer in silence. We are here to support the people of the city in whatever way we can. Thank you all so much. It's been a pleasure to spend this time with you. We are definitely in this together. Although separated physically, we are socially still one city, and we, as a resilient city, will continue to do everything we can to get through this. So, thank you all so much for joining us here today.
Thank you, Mayor Breed. Thank you, everyone. Thank you.
Is out? Okay. Did I?
Mayor,
I wanted to say thank you to. Hello.
hi, I'm here. I'm here.
Oh,
Are we out?
yes. Thank. Yeah, they took us out. Hold on.